Additional connections. In the endocrine control, this is a crucial endocrine link outside of the reproductive system since PCOS seriously impairs non-reproductive hormones, especially insulin. Insulin resistance. Many women with PCOS have insulin resistance where the body doesn't respond well to insulin. As a result of this, the pancreas produces more insulin than normal to keep blood sugar levels stable. The effect of this is high insulin levels stimulate ovarian androgen production, worsening PCOS symptoms like acne, hair growth, and infertility. Hormonal, the hormonal feedback loop is this affects the hypothalamic pituitary axis, not just ovaries. It can also contribute to the metabolic syndrome. Blood circulation and cardiovascular risk. Even in young women, PCOS raises the risk of cardiovascular disease. This occurs as a result of multiple interconnected factors, which are elevated blood pressure, increased LDL, bad cholesterol, and trig triglycerides, and reduced HDL, which is good cholesterol, inflammation, and endothelial dysfunction, which affect the lining of blood vessels, higher clotting risk due to abnormal blood flow and hormonal levels. This matters because these factors can lead to long-term complications like heart disease, stroke, and vascular damage, even in women who don't appear overweight.
For mechanism, normal physiology and anatomy. In the reproductive system, focusing on the HPO axis, the hypothalamus releases GnRH, which leads to stimulating the pituitary gland. The pituitary gland then releases FSH, which helps promote follicle growth in ovaries. The pituitary gland also releases LH, which triggers ovulation, which is the egg release. In the ovaries, mature follicles produce estrogen, and after ovulation, the corpus luteum forms and releases progesterone. The uterus then responds to hormones by building and shedding the endometrial lining, which helps lead to a regular menstrual cycle. In the endocrine system, pancreas releases insulin, which allows glucose to enter cells and regulates metabolism. Insulin also affects ovarian function by modulating hormone production. PCOS mechanism, the disruption of physiology and anatomy. The starting point, which is endocrine disruption, we start with insulin resistance, meaning the cells aren't responding, which leads to the pancreas producing more insulin. During hyperinsulinemia, which is high insulin in the blood, it will stimulate ovarian theca cells, which leads to an excess in androgen, which is testosterone production. It also decreases SHBG, the sex hormone binding globulin, so more free testosterone circulates. This overall results in a hormonal imbalance and metabolic dysfunction. For reproductive disruption, which is the downstream effect, we start with high insulin and high androgen that interfere with the hypothalamus pituitary ovarian axis. When FSH is low and LH is high, which means now that follicles won't mature properly. There is no dominant follicle, which leads to an ovulation with no egg release. Without ovulation, there is no progesterone, and without that, there are no regular periods. The endometrial lining builds up unopposed by progesterone, risk which leads to a risk of irregular bleeding or endometrial hyperplasia. Symptoms and observable effects. For the symptoms and mechanisms, for the first symptoms, irregular or absent periods, this leads to no ovulation, which leads to low progesterone, and that leads to endometrium. not shedding regularly. For infertility, that means the mechanism is no ovulation, which equals no egg release. The symptom of acne, oily skin, and hair growth mechanism is elevated androgens, which is testosterone. The symptom of weight gain, especially in the abdominal area, is due to insulin resistance and fat storage. Dark skin patches, known as acanthosis nigricans, is a sign of insulin resistance. How treatments target these mechanisms. Um, the first treatment of metformin, it reduces insulin resistance, which then lowers insulin, which then reduces ovarian androgen production. For letrozole, um, it targets the mechanism by stimulating FSH, which helps follicles mature and that promotes ovulation. For oral contraceptives, it suppresses LH, it lowers androgens, which in return regulates the cycle, reduces acne, and the excess amount of hair growth. With spironolactone, it blocks androgen receptors, which reduces the excess amount of hair growth as well and reduces the effects of the acne. Weight loss, diet, and exercise, like the lifestyle changes that were mentioned before, improves insulin sensitivity, restores hormone balance, and may also help you start ovulation again. In this image that I decided to put, it's the hypothalamus pituitary axis, and I just liked it because it showed the communication between the hypothalamus and the pituitary gland. The axis is important when looking for regulating the release of hormones throughout the body, and because it influences various functions like growth, metabolism, reproduction, and our response to stress. So this one is for the follicular phase, the mid-cycle, and the luteal phase. These are our sources.